nation, under God, indivisible, with liberty and justice for all. Before we do start the meeting, I would like to again remind everyone, if you're not living in the same household, please separate by at least 6 feet from who you are sitting nearby. I'd ask Misty if you'd call the roll, please.
David Burris.
Here.
Ray Eckefe. Bill Lukens.
Here.
Bob Nelson.
Here.
Ron Richards.
Here.
Allison Ritterbusch. Here. Craig Romey.
Present.
Caitlin Turner.
Here.
Thank you.
Okay, we do have a quorum. The first item is to adopt the agenda. I'd ask if there be a motion to approve the agenda.
I'll make a motion to approve the agenda and add one item to the agenda. Ordinance number 1212, an emergency ordinance to address a public health crisis by implementing certain measures which have been deemed necessary to slow the community spread of coronavirus, COVID-19.
Second.
Okay, it's been moved and seconded to adopt and approve an amended agenda to add ordinance 1012. Any discussion? Hearing none. All those in favor signify by saying aye.
Aye.
Opposed? The agenda is approved, and again, I remind the council members, if there is any items on the agenda that we're voting for tonight, that you have a conflict of interest, please notify the entire council prior to voting. We also have an item C to request to waive council pay for this special meeting. I'd ask for a motion to approve that.
I'll make a motion to waive the council pay for the special meeting.
Second.
Been moved and seconded that the council waive pay for the second meeting. Is there any discussion? Hearing none. All those in favor signify by saying aye.
Aye.
Opposed? Motion carried. Before we consider the items on the agenda, I just want to make some introductory comments. It's kind of amazing how life can change in an instant. And we've seen that in our nation this past month. We're facing a worldwide pandemic, a national emergency, and our governor has signed an executive order and issued that we are in a state of emergency even within our state, South Dakota. Here in Hot Springs, we've gone through a lot. We faced the closing of our Veterans Administration hospital, and then gotten some good news that it's coming back. We've had a fire that's uprooted 3 very prosperous businesses on River Street. And now our community is forced to face dealing with the COVID-19 pandemic. We're a community that cares. We care for people. We've got here the State Veterans Home, the VA, Pine Hills Retirement Community, Fall River Health Services with the Seven Sisters Nursing Home. And all of these institutions that care for people are filled with high-risk people for COVID-19. These people that occupy these facilities are cared for by compassionate caregivers that live primarily in our community. And our hope is that these caregivers do not become carriers of a very serious virus. But one of the things I love about this community is that it comes together in a crisis. It's amazing, I just got a call the other day from one of the local business persons, High Mountain Outfitters. They had recently had a fundraiser for the fire victims. And they were asking, they couldn't get a hold of a couple of victims and asking how they could get get a hold of them so they could donate the thousands of dollars that they raise on behalf of those in need. That's the kind of community that we have. We can come together and we face difficult times we have, and we will get through this together also. Tonight, our purpose for gathering is to set guidelines for our community, how we handle this coronavirus, how we flatten the curve, so to speak. I like to say that we're one sneeze away of having a case here in Hot Springs and Fall River County. We're maybe a couple sneezes away of having community spread. Community spread is what we want to avoid because it's very serious. Once that virus gets established in a community without measures to prevent the spread, it doubles at a rate of 2 to 3 times every day. I care about that primarily because I've got a son that's an intensive care pulmonologist that works in Gulfport, Mississippi. New Orleans is now one of the new developing hotspots for community spread in America. And my son is supposed to be off this weekend. He's been called in because many of those patients have spilled over into the Gulfport area. So this is a serious thing that we're facing, even though we in western South Dakota have very, very minimal impact so far. The victims medically suffer, and some of those that are high-risk patients suffer greatly, even to the point that this virus can kill. But there are other victims of this virus. Some of you are sitting in this room tonight. You're small businesses. You're the backbone of our community. And we have a responsibility also to ensure that we make a right decision as a governing body to ensure that we give you every chance to survive this pandemic also from the standpoint of small businesses. We've got a very proactive governor. I've been very pleased in the way she has addressed this issue throughout the state using facts, data, and science. She set down some guidelines, and those guidelines we'll be recommending here tonight to look at as a governing body and ask you as an audience if you have comments to give us your thoughts and your opinions. What we're discussing here tonight, though, I remind everybody, is on the current situation. And that can change as early as tomorrow, when the next round of those stricken with the coronavirus are posted on the State Department of Health website. There could be a very significant change in Fall River. There could be a very significant change in western South Dakota that would affect us. So what we want to do is be flexible. And what I want to do tonight is read through the resolution that we have based on what the governor has laid down in her statement, her executive order. And then we'll open the microphone up for public comments, and I think it's important to note that's a good place to pass the virus. So I think Letha has provided us with some plastic bags that once you speak, we'd ask that you take that plastic bag off, and then the next speaker can also do that, address that in a similar fashion. Also, we have some wipes there that would also help keep that clean. So as we go through tonight, what I want to do is real quickly summarize what we'll be looking at as a resolution, and it deals with several things. First of all, our individual responsibilities. Each Hot Springs resident should make sure we're familiar with the CDC hygiene practices. Wash your hands multiple times. Use hand sanitizer. Try to keep the spread of the coronavirus and encourage others to do the same. We should know the symptoms, that if you are in a situation where you're experiencing a fever, cough, sore throat, have difficulty breathing, call your health providers. And if you do feel any kind of symptoms coming on, stay home, stay away from work, call in sick. Understand that we have many in our community that are high risk and vulnerable to that virus, particularly those over age 60, those suffering from respiratory condition, having reduced immunity. We ask those individuals to consider staying at home and as much as possible, and take extra precautions. I think it's important that we implement social distancing measures, but it's also important that we support our local businesses. And I think we've got many businesses that are adjusting their business practices and business models to help reduce the spread, and they've done that voluntarily. And I compliment each and every one of you that have taken those actions. And then it's important that we assist and be considerate of our medical professionals. They're the ones that are on the front lines. We've got emergency responders, and even our law enforcement are involved in meeting people that could possibly carry this virus. If we look through the resolution, we also have guidelines for every employee, both for profit and nonprofit organizations that operate within our community. And we want to, again, have each and every one of these businesses and individuals operate under the CDC hygiene practices, and also with business practices that are designed to reduce the spread of the disease. I would want everyone to be aware that the COVID-19 pandemic is not a short-term challenge, and Governor Noem, particularly in her press conference today, mentioned that we may have to endure a difficult time with limited social environment until this pandemic has subsided. I'd ask that each business owner and nonprofit be encouraged to innovate, demonstrate entrepreneurial excellence in their operations, and throughout this uncertain environment. Things like encouraging people to work at home through what we call telework, implement social distancing measures, limit unnecessary gatherings or meetings, limit non-essential travel, consider regular health checks, and again, use the CDC guidelines extensively to screen. And if possible, offer special shopping times or business openings or appointments for those that are vulnerable to the COVID-19. And then we have many businesses that operate within a closed environment that promote public gatherings. And I would ask that through these guidelines, these businesses such as bars, restaurants, cafes, casinos, coffee shops, athletic facilities, health clubs, bowling lanes, entertainment venues, as such, similar facilities would modify their business practices within the CDC guidelines so as to accommodate a maximum of 10 people to occupy one enclosed space where physical separation of at least 6 feet can be maintained. I'd offer that there would be business models that do not require the public to gather, where such things as drive-through service, takeout, delivery, curb service, off-site services, social distancing models, and innovative solutions could preclude such gatherings. I was really pleased to see in today's Fall River Herald Star the idea of cruiser night. What a neat way to support our downtown businesses by getting out, using the curbside service, drive-throughs, and just kind of cruise Main Street like some of us used to do in high school when gas was 35 cents a gallon. So I really appreciate that idea, Brett, and I hope that many of our citizens take care of that. But that's the kind of thing that we can do to help keep our businesses afloat. Then there are businesses that provide needed community services. Our grocery stores, pharmacists, hardware stores, farm and ranch. Businesses like this, you know, we think we all need food and medicine, but what do you do if the toilet breaks? You need to go to a hardware store and get something to fix it. Your car breaks down, you need to go to an auto parts store. So we want to keep these businesses open also, but we encourage them to develop procedures that encourage social distancing, particularly at critical points of service, such as checkout lines, where you pick up products and so forth. And again, there's things such as implementing curbside pickup, offering delivery, or available drive-up windows wherever possible. This would help keep the disease from spreading. We'd also encourage increased cleanliness at these businesses, as frequently wiping off high traffic areas, service counters, vending machines, and so forth, those things frequently touched by customers. And then we would also wish that these businesses would keep an adequate supply levels of those things to support the community in our purchase of critical items or products that are in short supply. And we can all think of one thing that has been highlighted frequently the past few days about that. We also want to address for healthcare, churches, and other religious organizations. And these are medical offices or dental offices, counseling centers, churches, or other nonprofit organizations that serve our public. Again, we'd encourage following the CDC guidelines to include proper social distancing practices. Wherever possible, limit the gatherings to less than 10 people. But here again, we have an age of technology where we can teleconference or live stream or put things on Facebook to meet the needs of the public and while serving those mission of the organization. And we as a city also have a responsibility, and again, to follow those CDC hygiene practices, accommodate both employee and customer needs. I think it's important that we, as a city, and it's something that I've been trying to do the entire past several weeks, is to monitor the situation by using the South Dakota Department of Health, local medical resources, the CDC website to determine how best to handle the developing situation. And That's one of the reasons that we are recommending these things that this resolution recommends. Again, we want to try to restrict public gatherings of 10 or more unless absolutely necessary. And tonight we felt it was necessary. We have a large space and we wanted to use proper social distancing but limit the attendance here to 50 this evening. And then we want to offer the maximum opportunities for our citizens to use city facilities. Places such as Evans Plunge, our Mueller Civic Center here, the golf course, the library. But again, we want to make sure we fall within the CDC guidelines and develop additional practices that protect the public should changes rapidly occur. Guidelines set forth in this resolution aren't intended to create any hardship or benefit to any particular business. And I want you as a council to know that, and also the citizens to know that. And as we, that basically summarizes what we'll be voting on tonight. What I would like to do now is go on to our agenda item as communications from the public. You've heard generally what we're trying to do, and we'd like to get your input as a public because this situation, crisis that we're in does impact you. So I'd offer the microphone to anyone who would like to make comments from the public. If there are none, I would ask then that we have some. Okay.
I just have a couple questions. Okay, I guess my first question would be is, should it pass, what the timeline would be. Like Custer, I know theirs doesn't go into effect until April 9th. Rapid City is 7 o'clock on Friday night. I mean, everybody has different, I mean, it's a set number of days. I didn't know if you guys had a set number of days.
What we have, the reason we're doing a resolution is that we don't have the wait time that an ordinance has to go through, so that if something changes rapidly, we would have to go through that. We'd have to go through that process again, and we want to protect the public. So basically, this would go into effect after it's passed, and we have it written into the resolution that it would last through the first meeting in May. But again, with the resolution, if the situation improves, we can come together as a council, lift restrictions, or if the situation worsens, which is predicted by the models that the governor and the state is using, we could add more stringent recommendations for the community.
Is there any way a couple days can be put into that? I mean, you're letting, at the winter circle, I'm not going to be able to employ everyone. That just won't be possible.
You're not what?
I won't be able to keep everyone on staff.
Okay.
That's just not feasible. So I would like to have more than, you know, sorry guys, this is it. Not to mention food waste that we're going to have. You know, we're not fortunate like the other drive-throughs.
Okay. Can you offer curb service?
Yeah, we can offer curb service. That's what's the other thing.
Can you, you've got several different rooms, could you limit those different areas?
Yeah, if that's something that you guys would allow. I mean,
Well, that's part of the resolution.
Okay.
That you know, that's why we're not, you know, we don't want to hear, I've got to close down. We want to try to make it work, so we're following the CDC guidelines, minimizing that opportunity for the spread of the virus, while still keeping places for the public that feels good to go, opportunities for them to enjoy the good food that you have, and and so forth.
So I guess that was my question, because everybody's is different. I have read through Gnomes, I've read through Rapids and Custer's. So I didn't know if this one was going to allow, you know, them to come in and pick up their order. Are you going to allow us to have 10 people in there? You
Yes,
know, how that was going to,
yes.
so it would allow.
And even, you know, if you have different rooms, there are 10 people per room, if
Okay.
you want to rearrange so that you've got different areas, that's what the intent of this is.
Okay.
Is so we don't have a bunch of people crowded together closely.
Okay.
Lori, a copy of the proposed resolution is up on that table with the agenda. You're welcome to take one and read through it if you haven't seen it yet on our website.
I looked on your website, yep, I did. I just didn't quite understand. I just wanted to make sure, I wanted to clarify.
No,
That's-
absolutely, and I appreciate your questioning, your concern, and we're concerned for you too.
And can I add some, just,
Yeah, absolutely.
it's important not to just focus on the 10 people per enclosed space, but also if you have those 10 people, that they have the 6 feet, so.
Yeah. Okay, no, that's all I had. Thank you.
Thanks for the question.
Are there any other questions or communications? Okay,
Can I just speak from here, is that okay?
No, we do need to have you come to the mic so that we can pick it up on the video things.
And I need the
Oh,
name,
yeah, gotcha.
George.
Yeah.
Hello, I'm David Zortman. I'm one of the
David?
owners of the Wandering
David?
Pines and Coffee. Yeah. Who's talking?
I am. I'd be happy to come up and remove the plastic bag for you so you don't have to touch it. And then put another one on top of it.
You got a place to dispose of?
Right there is fine.
Just leave it there, that'd be fine.
It may seem like we're paying folks, but we're doing everything we can to keep you separated out there, and then we're asking you to speak 6 inches into a microphone that somebody else just spoke into.
So my question is, I mean, everything sounds fair, and I understand. I think we'd be able to work under this resolution. But what happens if people don't follow this resolution? That's my question to you guys.
Well, we would hope that we would be able to identify those individuals, and that we would certainly consider that with the full council. And we don't have any mechanism, to be perfectly honest with you, of creating a fine, but we do feel that by making those businesses identified as not following the regulations, that public opinion would help enforce that. If that becomes a continual problem, then we would have to go to an ordinance that would give us additional teeth to be able to make those fines and shut those businesses down. Are there any other questions or comments from the audience? And we also have a removal there.
I've been side by side with him all day. So, News Center 1 just came out 20 minutes ago and said that there's a new case down on Todd County, which is on the reservation.
Okay.
So what happens is people coming into the communities are what giving this off. What is the city's stance on stopping people? You know, the news reported that people from New York are trying to get into Deadwood and South Dakota because we have a low rate. What is the city planning on doing? Stopping people from coming here into our hotels, into our eating establishments. What is the city doing to stop that? Because that's where it's going to start. It's not going to be, you know, mom coming downtown and all of a sudden she's got it. It's going to be because somebody else came in that wanted to be here, you know, because we've got lax policy or whatever, and then winds up getting somebody here sick.
Okay, and Greg, could you please state your name also?
I'm Greg.
Name, so we got your name, last name in that.
Gunwall.
Okay, thank you, Greg.
Yeah.
Greg Gunwall, thank you.
That's my
That's,
concern.
we have no authority or ability to stop people coming in and out of the community. That, again, would have to go into a higher level of legal authority, and we don't have that capability, and that's why that's one of you're exactly right. That's where the largest threat is someone coming in from out of town, out of state, and we're monitoring that. We've had, for example, a city employee that just came back from vacation a week and a half ago. That's in voluntary quarantine. We've had other individuals that have come back from foreign travel that have voluntarily gone in. I noticed on Facebook we've got another family that's coming back from Europe that has noted that they're going into voluntary quarantine. But that's all that we can ask, and that's why we need to follow the safe distancing procedures so that those people, if they are a carrier, won't necessarily impact people around them.
Yeah. Okay.
So Heather Zortman, other owner with Wandering Bison, and I just wanted to add additional comment to our visitors from other areas. They're here. I've seen a few at the shop. I just wanted to add additional comment to that. Not that we can tell them to go away, but it's just something to have in the back of
And
your
I'm
head.
sorry, I'm having a real difficult time.
Sorry, I just wanted to add additional comment too about some of our visitors here in the local area. They're here. I don't know if they're staying here in Hot Springs, but they're here. So it's just something to have in the back of our heads that they're here to that they're chasing the virus, but they could be adding additional exposure to us. So, I mean, it's just something to have there in the back of our heads. So, I know that Custer their emergency management put out a thing about their snowbirds and how they should be self-quarantined if they're coming back from, but just being on the ground and in the community and seeing them come through our doors, but these people they're here and they might be bringing it with them, so that's all I have to say.
No, absolutely, and that's, obviously one of our biggest concerns and one of the reasons why we're doing this. Obviously, we could be extra safe and close those type of businesses that would cater to our visitors, but we don't want to do that at this time. Are there any other comments?
I think you guys should make it mandatory that no visitors that live here.
We can't hear you. Can you come up?
Don's on with the Red Shed Smokehouse. I think that I've seen people like they're talking about, and I know that they're here. I think you guys have to make an ordinance to make them self-quarantine themselves because they're coming. A couple from Hawaii, they're coming from all over. I think that's you guys need to focus on. There's a lot of people that have private property that live in different states. that are running to their private property to get away from the crap where they're at. I think the city needs to really look into making these people mandatory quarantining themselves for 14 days or better.
Do you have a suggestion of how that would be done? Because
I
we have no one
understand
that
that.
state
I
line that
understand
will
that,
actually
but-
be able to follow them to their properties. We have no idea of knowing who's crossing our state to go to another state.
Well,
I totally agree with
there
what
is a
you
list
said.
of who owns these properties and where they reside, correct? To take a little bit of research on you guys' part, but there are people that have a lot of mechanical that live in different parts of the country that are flocking back here because of that.
Thank you.
Thank you.
Any other comments or from the public? Okay, hearing none, I would ask that the council would consider Resolution 20-11, and I would accept a motion to approve that emergency resolution.
I'll make a motion to approve Resolution 2020-11, an emergency resolution to address a public health crisis by implementing certain measures which have been deemed necessary to slow the community spread of coronavirus, COVID-19.
Second.
It's been moved and seconded that we adopt emergency resolution 20-11. Is there any discussion from the council?
I'd just like to say I appreciate the comments from the public. Your concerns, I think, demonstrate what Governor Noem has said various times in the press conference, and that our mayor has discussed that it's probably coming. The intent is to flatten the curve, slow it down, so that we can manage it in as sane as way as possible. So again, I wish we weren't in this situation. I've made the comment a couple of times, if we were in a world war, I think we would have much more experience on how to handle this, but this is very new territory for all of us. So again, thanks each and every one of you for your comments and for what you're going through to get through this as individuals and as businesses, and I appreciate the work the council and the city staff has gone through to get us get this resolution to this point.
I'd like to share with the public and the council why I asked to have an ordinance added to the agenda tonight. First, I want to personally thank Mayor Cotty for showing the leadership to get Councilman Lukens, John, Misty, and myself together Tuesday morning to talk about how the city should address the coronavirus. We all know what's out there. And at that time, we had talked about how heavy-handed the city needed to get, and whether a resolution was the right option or an ordinance was the right option. At that time, we felt that probably the better thing to do was give the public an opportunity to police themselves and do the right thing. Not only do the right thing for their family, but do the right thing for their neighbors. So that was Tuesday morning, and I was on board with the resolution. A little hesitant, but felt that at that point it was probably the right thing to do. So then we get to Tuesday evening. And Tuesday evening in the Rapid City Journal, Monument Health announces that they now have their first confirmed coronavirus in Meade County. Wednesday morning, Monument Health comes out and says that individual that was confirmed with coronavirus has now been in contact with 112 people. We also talked about the fact that a lot of folks are saying, well, we don't have coronavirus in the Black Hills. Well, the statement isn't accurate. At that point, we didn't have any confirmed cases of coronavirus in the Black Hills. But because you don't have any confirmed ones, doesn't mean you don't. Well, Tuesday night, we found out we did. Wednesday, Spearfish announced that they have one. Today, Governor Nome announced that 5 new cases have shown up. They're all East River, but they're out there. The ordinance that I asked to be added to the agenda is not my words, it's not my ordinance. And looking at the South Dakota Municipal League, which the city relies on an awful lot, they have examples of ordinances from other communities: Brookings, Huron, Mitchell, Mowbray, Traverse City, Sioux Falls, Watertown, and Yankton. And I'm not the type of person to just follow suit because somebody else is doing it. That's what we should do. It needs to fit our situation. But everyone is beginning to recognize that maybe resolutions aren't the best solution. And that's what I wanted to hear from you folks tonight, how you feel about it. And I want to hear from the council how they feel about it. We've identified, or we've talked about the fact that this could get worse. A resolution, and we asked our city attorney to help us understand an ordinance or a resolution. So this is his response. It is my belief that a resolution is more of an opinion of the city, or it is used to carry out the normal business functions of the city, carrying out its administrative duties and functions. An ordinance, on the other hand, is tied into the powers of the city, such as zoning and prohibitions. For example, we have an ordinance that gives the city the power to annex property. We then use a resolution to annex the airport. So the ordinance established the power, and the resolution was used to administer that power. To the lady's question about when it would go into effect, or possibly what some of the differences are, the ordinance certainly is stronger in language. An ordinance would require 2 readings. My concern about a resolution is if we decide 5 days down the road, the resolution isn't working for us, and we want to go to an ordinance, we now have to add the additional 5 days between the first reading and the second reading, and then the ordinance has to be published. So we just keep pushing the solution down the road if we don't take a stronger stance tonight. In the ordinance, it does limit on-site. If I'm reading here. Places of public accommodation offering food and beverages for on-site consumption, including any alcoholic licenses with an on-sale privileges, are closed to on-site, on-sale patrons. These businesses may continue to operate in order to provide takeout, delivery, curbside service, and drive-through service. Churches, recreational facilities, public pools would end up being closed during this emergency. It would take effect April 9th, because an ordinance tonight would be the first reading of it. In 5 days would be the second reading. And if we're going to have to come back and address this again, because the resolution isn't working, the ordinance gives us opportunity to get out ahead of it. It wasn't easy to ask to have the ordinance added tonight. I know the mayor felt that we needed to do a resolution only. I just think we need to have an option B if the public feels that a resolution isn't strong enough, or if the council feels that a resolution isn't strong enough. If that's the opinion of the council, and we don't do anything with the resolution tonight, we're done if it's not on the agenda. We at least now have an option if you feel that isn't the right solution. Again, I appreciate the mayor's leadership, and I regret that I took the actions that I did, but I felt it was necessary.
Are there any other comments?
I myself, I appreciate the resolution, just like Bob said. I'm for the ordinance. I think we need, more teeth in it. Just not kidding.
I have to second that myself. It's common, folks. If we don't use prepare ourselves for the future, which could be not even a week away. If we don't have some teeth in this, we're not good. You might as well just say, please do this. At this point, we have step A, step B, but I'd rather go a little above and beyond and say that we're prepared for it to be here.
So I was ready to go and throw up barriers to all of our town limits, you know, I was ready to do that for sure. And I still feel very protective of us that we're in this bubble and that people traveling tend to be the potential risk here. And I do agree that a little more teeth involved in as far as putting down some more rules as far as if you've traveled, what we expect and what we would hope. I also feel like us as businesses, our private businesses, we can put that out there that if you've traveled, please don't enter into my business. So there are some of those things that are out there on the internet that I know that I've used for my business as well to make sure that if you've traveled within the 14 days, then we need to reschedule your appointment or don't come into this. So, but I am with a little bit more teeth in that as far as what we expect.
Okay, I would ask that Bob, you would go ahead and cover the ordinance in detail as to what the specifications are so the public is aware of what you're asking our businesses to do.
Thank you. Misty, do you know if the council and the mayor has the most recent version that I've asked you for?
I don't believe so. The only thing that was added from the version that they have would be that item number 12, so if you be sure to highlight that.
Do you have copies for the public if you're going to be voting on something like this?
We don't, but the public can certainly have copies because tonight would be a first reading, and we haven't decided whether we're going to approve the resolution or not. But once, if it doesn't pass and the council wants to consider the ordinance, then there is a 5-day waiting period, so you folks can take a look at it and decide whether you like it or don't, and then we have to come back for a second reading, and then you can shred us at that point if you feel that it's too strong and it can be changed. If the opinion is that it needs to be changed based on council input and public input, and it changes significantly enough, then we'd have to come back for another first reading. So you will have the opportunity to.
I have a question.
You have a first and a second on the resolution to approve. I haven't heard, did it approve or not approve?
No, we
It
haven't
hasn't been voted on.
We're in
We're
the
still in
discussion part,
discussion.
getting further information as far as what's the best decision regarding move forward with the resolution and vote on it, or should we get all the information regarding the ordinance so we can make a better decision about voting on the resolution.
And I would ask that someone would read those, what we're discussing, so that the public has at least some idea of what the ordinance would say.
And Misty, you identified item number 12, to highlight that one?
Well, I would go ahead and read all of it,
Okay.
if you don't mind.
From the therefore be it ordained.
I'm fine with reading it. And so the public has the resolution in front of them. I'm comparing here to see where they match. Now, you want me to read the whole thing, folks?
Yep.
Yes.
Okay, I'd be happy to. Ordinance number 1212, an emergency ordinance to address a public health crisis by implementing certain measures which have been deemed necessary to slow the community spread of coronavirus COVID-19. Whereas, the City of Hot Springs has the authority pursuant to South Dakota Codified Law 9-29-1 and South Dakota Codified Law 9-32-1 to pass ordinances for the purpose of promoting the health, safety, morals, and general welfare of the community and to do what may be necessary for the promotion of health or the suppression of diseases. And whereas an outbreak of the disease COVID-19, which is caused by the novel coronavirus, has been confirmed in more than 100 countries, including the United States. And whereas COVID-19 is a severe respiratory disease transmitted by person-to-person contact or by contact with surfaces contaminated by the virus. In some cases, especially among older adults and persons with serious underlying health conditions, COVID-19 can result in serious illness requiring hospitalization, admission to an intensive care unit, and death. And whereas the World Health Organization, the Centers for Disease Control and Prevention, and the Secretary of the U.S. Department of Health and Human Services have declared the outbreak of COVID-19 as a public health emergency. And whereas on March 13, 2020, President Donald Trump declared a national emergency in response to the global pandemic of COVID-19. And whereas on the same day, Governor Kristi Noem issued Executive Order 2020-04, which declared a state of emergency to exist in the state of South Dakota in response to the spread of COVID-19. And whereas cases of COVID-19 have been confirmed in South Dakota, and whereas the CDC and health experts have recommended social distancing to slow the spread of COVID-19, and whereas social distancing is a method of slowing down or stopping the spread of a contagious disease by reducing the probability of contact between infected persons and those not infected in order to minimize disease transmission. And whereas, in response to the need to implement social distancing, all schools in the state of South Dakota have been closed for at least 2 weeks. And whereas on March 16, 2020, the White House issued guidance recommending that social gatherings of more than 10 people be avoided, and that people avoid eating or drinking at bars, restaurants, and food courts. And whereas the guidance issued by the White House further recommended that in states with evidence of community transmission, bars, restaurants, food courts, gyms, and other indoor and outdoor venues where people congregate should be closed. And there's a lot more whereases. Whereas many states and communities across the country have already implemented the White House recommendation by ordering all bars, restaurants, food courts, gyms, and other indoor and outdoor venues where people congregate be closed until the public health emergency is over. And whereas the failure to successfully implement social distancing will likely result in higher numbers of infected individuals and has the potential to overwhelm the capacity of the city's health care providers. And whereas it is important that control measures be taken to reduce or slow down the spread of COVID-19 in order to reduce the health and safety of the city's residents, especially for seniors and those with underlying health conditions that make them particularly vulnerable to COVID-19. And whereas on March 26, 2020, the Hot Springs City Council met in an emergency meeting at 6 p.m. to discuss COVID-19 pandemic and local public health issues and considerations, and take further action relating to the COVID-19 pandemic. And whereas on March 26, 2020, the Hot Springs City Council approved Ordinance 1212, declaring the existence of a health emergency in the city of Hot Springs as a result of COVID-19. Now therefore be it ordained by the City Council of Hot Springs that, effective at 6 p.m. April 9, 2020, all restaurants, food courts, coffee houses, bars, breweries, clubs, cafes, and other similar places of public accommodation offering food and beverages for on-site consumption, including any alcoholic licenses with on-sale privileges, are closed to on-site, on-sale patrons. These businesses may continue to operate in order to provide takeout, delivery, curbside service, and drive-through service. Any business continuing to operate in order to provide off-site service should implement procedures to ensure social distancing and operate in compliance with federal and state health guidance in order to prevent the spread of COVID-19. Effective at 6 p.m., April 9, 2020, all churches, recreational facilities, public pools, health clubs, athletic facilities, and theaters, including movie theaters and music or entertainment venues, are directed to close and cease operations during this emergency. Effective at 6 p.m., April 9, 2020, all cigar bars, vaping lounges, or other similar businesses that allow for on-site consumption are directed to cease allowing on-site consumption, but may continue to offer products for sale to consume off-site under the same conditions as bars and restaurants outlined in paragraph 1. Effective at 6 p.m., April 9, 2020, all arcades, bingo halls, bowling alleys, casinos, and other similar recreational or entertainment facilities are directed to close and cease operations during this emergency. Effective at 6 p.m., April 9, 2020, all other retail and service businesses in which more than 10 people are gathered or permitted to gather at the facility are directed to close and cease operation. The prohibitions and closures in this order do not apply to the following businesses: places of public accommodation that offer food and beverages for off-site consumption, including grocery stores, markets, retail stores that offer food, convenience stores, pharmacies, drugstores, and food pantries, other than any portion of such business which offer on-site consumption, which would be subject to the requirements of paragraph 1. Hardware and supply stores, room service and hotels, healthcare facilities, residential care facilities, congregate care facilities, and correctional facilities, crisis shelters, homeless shelters, soup kitchens, or other similar institutions, any emergency facilities necessary for the response to the current public health emergency or any other community emergency or disaster, official meetings of the city, schools, county, or state, the operations and meetings of any state or federal courts. However, owners, operators, and managers of such are strongly encouraged to implement CDC recommendations to include social distancing and sanitization guidelines in their place of business until the expiration of this emergency order. All other businesses not mentioned in this order are strongly encouraged to implement CDC recommendations to include social distancing and sanitation guidelines in their place of business until the expiration of this emergency order. Any violation of this ordinance is subject to the general penalty provisions applicable to all other violations of the Hot Springs City ordinances. Each day a violation of this ordinance is allowed to occur is considered a separate offense committed by the persons in charge of the facility in violation. This ordinance shall apply to all persons, facilities, and locations within the city of Hot Springs. This ordinance shall remain in effect until May 31, 2020, at which time it shall be automatically repealed unless specifically readopted for an additional period of time by the City Council. Any dates identified in the ordinance for closures to automatically end may be adjusted at any time within the 60-day period covered by this ordinance by an action of the City Council. Additionally, while this ordinance is in effect, it may be amended, suspended, reinstated, or repealed by a resolution of the Hot Springs City Council. This ordinance shall not supersede any declarations, laws, or emergency proclamations of the federal or state government. Be it further ordained that pursuant to South Dakota Codified Law 9-19-13, this ordinance is necessary for the immediate preservation of public peace, health, safety, and welfare of the city and shall become effective immediately upon passage. Dated this 26th day of March, 2020. Appropriate areas response for the signature of the mayor to sign and the city administrator.
Thank you, Bob. Appreciate the time and effort. Are there any further comments from the council?
I would propose that we vote on a resolution 2020-11 and pass it.
Before we vote, I would like to ask for communications from the public.
Can I finish?
Go ahead. I'm sorry.
And at the same time, make this first reading of ordinance number 1212. And ladies and gentlemen, just because we have this doesn't necessarily mean we're going to implement it. But it is something there that we have, that we, if we have a problem, we can use. It's just a tool, that's all it is. But the thing is, if we don't take steps for what may happen in the near future, then we'd be lacking in what we are setting up to do for our community. And that's my honest opinion. Go ahead, Mayor.
Okay, thank you. Sorry I interrupted. Are there any communications from the public now that you've heard the ordinance?
I'll cover up the microphone with the- Okay, my question is on the ordinance. So it's we'll have to go to go, we won't be able to have our 10 people, which I understand, which in my opinion makes sense in Rapid City, Sioux Falls. But I would venture to guess, since this is hit, at any one time, there is more people in the grocery store than to say the coffee shop or the winter circle. Our business has dropped that much. So I have to be completely shut down, other than they can come in and do to go. But there could be 50 people at the grocery store, and they'll spend more time in there than people will spend in ours. So do you see what I'm saying? Or if they were to go get coffee or sit and have a coffee, sometimes people will visit the grocery store longer than that. How is that okay, but not having 10 people?
I would think the grocery store is a little bit more necessary than fast food or coffee.
No, I agree with that, but we all got mortgages.
Right.
And I'm just saying, there's more people in the grocery store than is in my place of business.
If we got to the point where we had to use ordinance number 1212, I am sure that the management of any grocery store is going to limit the amount of people that are going in their stores, just like we did tonight with people coming in here.
Right, but it's an assumption, and they won't get in trouble if they don't, is that correct? Not like we would.
There is always that assumption.
I mean,
I can't guarantee anything, just
So
like
why
I
can't
can't
they-
guarantee that we will ever even use this ordinance.
I know. I'm just
But the
asking,
thing
it's just
is-
food for thought. You're gonna have
Yeah,
more
no,
people there than you're gonna have
believe
there
me,
or here.
I have considered this very much so. I've worked with the food industry in our community very well. I've done it for years. I do know what I'm asking. I do know what I'm asking. And is it gonna hurt? Yeah. But I'm gonna be honest, if we don't take these steps, at least to get ourselves in line, if we do have a serious situation that happens in our community, like I said, I'd be lacking in what I'm doing for our community. And very honestly, if it got to that point, I'm sure that you will have an enforced from the state.
Well,
So-
and don't misunderstand, I know it's serious.
Oh, I
But
know.
it needs to be fair for everyone.
But all I'm
Across the board.
personally is suggesting is this is on the books for us to use as a tool. I'm hoping that it'll never come to that. But to be very honest with what was said earlier at the microphone, I can give you in a business today, 2 people from Phoenix come back to South Dakota. They had been in town not even 24 hours. First thing they did was gone to the local hardware store and then to one of our local grocery stores. They didn't even bother to find out whether or not we had curbside service. They immediately just come from Phoenix, Arizona. And so now how many of them people that they have interacted with today are in our community?
Right, I get that. All I'm just saying is should, maybe in the ordinance, there should be limits for everyone, not just for those individual people, I guess. It's just food for thought.
Yeah, I was just reading the ordinance closer as you were talking about that, because it does say it would, 10 or less people, you know, and then it goes on to say grocery stores would be, but it really should be under that same guideline. And so I see what you're saying that way. I would hope every grocery store would take it that way. That would be 10 or yet less, but it's not. Specifically, you will get in trouble if it's not that. No. Okay, I see what you're
And
pointing
just,
out.
we have already decided that we're gonna put signs up that say, if you're from out of state, please order or call for an order or whatever. We
I
have to do
think,
that.
I think most our food vendors here in our community are already, like you are, looking at steps that you can do. And that's why I said, this is nothing more than a tool. It's a tool that is there for us to use if necessary. And like it says, it's going to have a life limit. But I really feel like if we don't do something like this, we're lacking in what we've been asked to do for the community.
Right, and like I said, don't misunderstand, I understand
Oh,
that.
I understand what you're asking. It'd be more fair all the way around.
Right.
As it reads right now, but
I feel like I can control my crowd better than the grocery store can control their crowd. I mean, I can lock entrances and only, you know what I mean, and monitor that. They can't when they have that many people coming. So, anyway, just food for thought.
thank you.
So to your point, because the ordinance requires 2 readings,
Right.
if the council were to approve the ordinance tonight, they could do it with the provision of adding some language that addresses what you're concerned with as far as other businesses.
Okay, that's what it was about.
You know, they may want to do that, they may not, but that option's available. That would be a significant change to it, so it has to have 2 readings, so that could be in at the second reading. Council would choose to. So there are options to address what may need to be changed about the ordinance before we're passed.
Can we clarify that this is more than a tool, because once it comes into effect, it will be going. It's not something we just have on the shelf, it will be in effect.
Right, I think tool meaning if we need to move that forward with voting, but it would become an absolute ordinance at that point, that would be enforced. Yeah, so tool to decide if we needed to move that forward with voting on more than 1 reading, right? And then, okay, just making sure that that was, okay.
David Zortman again, Waterman Bison. First off, Dave, when you said this is a tool, isn't this the 5 days starts today, right? I mean, you guys will revisit this 5 days from now.
Right now, we're looking at this as having a tool. At this point as our discussion. Once we voted it in, which it may or may not get voted in, then it would, as it was read, would take place.
Okay, I just want some clarification on that. I understand it is a tool for something you might have to squeeze the trigger on 5 days from now. Just so I'm clear on that, right?
Right.
The effective date would be April 9th. It would have to be published. So we'd have to have a second reading by April 1st, and then it would be published in the Hot Springs Herald Star on their Thursday, the 9th publication to be effective that day if it passes.
Okay, perfect, thank you.
Yeah, it's just, we don't vote it in per se next week and it automatically that night. It doesn't work.
Okay, I understand. Now, Bob, with some of the stuff that you have here, as far as like, you know, my small business and even the bowling alley, you know, we're talking about just shutting down our on-site sales, correct?
Yes.
So why are we going so drastic? I know it's coming. My other hat that I wear, I'm a federal first responder, so I know how serious this is, okay? But right now, can we have some verbiage in there, just like the grocery store? Because I know I can like put chairs and tables away and meet all the spacing and still have a limit of 10 people and on-site sales. And then once we get to, you guys pass this ordinance, and we get to that point where we have stuff within our county and our city, then squeeze the trigger to go to point B, where then you can totally shut us down. Just a delivery and curbside service. Just something to think about. You know, to me, I think we should look at more than just one option. And I understand we have to take a hard line at this. Like I said, I'm a first responder with the federal service. Second thing, this group I think needs to come up with, instead of just signs that we're making up on our own, as a community, we should have a sign that has like 3 questions. You know, have you been in contact with but that's been tested positive. Do you have a fever in the last couple of days? And have you been out of the country or out of the state within the last 14 days? If not, then we need to look at trying to do some self-quarantine. I know we can't police that, but it's integrity that we're trying to put back on our public. And I think you guys should have some kind of message that us as business owners, we all stand unified to support you guys in a message that, you know, we come up here as Hot Springs residents, right? That's just a suggestion. And please consider that 10-person stuff until we really have that case to squeeze the trigger. I still think we could pass an ordinance, right? That has that built into it. Am I wrong, Bob?
Any language that's in if the first reading passes tonight, then the language can change for the second reading. So yes, any changes can be made that the council would deem necessary to make. To your point about, you know, the questionnaire or whatever, you know, it is that you were talking about, both the resolution and the ordinance encourage that kind of innovative thinking from each individual business that look at, you know, what questions do you want to ask before you let somebody in your business if you don't want somebody with corona. The city placing that on you, I think, just ends up getting more heavy-handed, saying, you know, these are the things that we expect. Be innovative. Come up with, you know, what you think are the appropriate questions to ask people, regardless of whether it's a resolution. Again, the resolution is a request for you folks to and private citizens to comply. But if you don't, there's not much we can do about that. The ordinance gives us that heavy-handed power to do that.
No, I understand. I mean, it's not an easy spot to be dealing with what we got going on right now nationally, and you guys being in your seat making these decisions. I just hope you're listening to some of our voice that maybe we need to be drastic in these measures, but let's write them in these things where, okay, we're at point A right now, so we're at the 10-person limit. Once we have something where we think within our county or our city that makes us go to point B, then that's when we go to that hard shutdown, you know, curbside or delivery.
You're talking about a staging system.
Yeah, absolutely. You know, I just don't think we should just be hard line on something right now where we're not there yet. But it's coming, and I agree it's coming. We can build something into this document to where you guys can have that teeth and be able to act, but at the same time still giving us room to operate because we're not there yet. That's all I'm asking. Thank you for your time.
Thank you.
Thank you for.
So I have a question for Garland to John's point. If we have a resolution that's passed and we have an ordinance that's passed addressing the same issue just at varying degrees, does the ordinance take precedence? And even though the resolution is on the books, you know, we can't utilize it? Or can we say, well, in this case, you know, can we choose which one we adhere to? That's addressing the same issue.
You could pass both of them because the resolution is kind of more of a suggestion and the opinion of the city, where then the ordinance is a law, basically. You know, it's got teeth, it has directives. So I mean, they're two entire, even though they're covering the same subject matter and kind of saying, hey, follow these recommendations, they're two separate items. So you could pass, the council could pass both of them. So
would we put ourselves in a position of an affected business saying, well, wait a minute, you're telling us over here we don't have to. We comply if we want to, but over here you're telling us we have to. What is it you want us to do?
Well, like I said, the resolution's more of an opinion of the city, kind of saying that lightly. But once again, if you pass the ordinance, that's the law. You know?
So the ordinance trumps the resolution?
Correct. Yeah. Oh. And I would make one comment. I know Custer, the city of Custer is meeting right now discussing these same matters. They're also considering the possibility of an ordinance just limiting everything to 10 people. Just to throw that out there.
Another question for Garland. Would it be prudent then, possibly at the time of the second reading of the ordinance, to then also have a vote to vacate the resolution?
As far as I'm concerned, the resolution and the ordinance can just, they coexist each other. As far as they don't contradict each other to me.
One
Because
is just a step, excuse me, but one is just step one. And then basically what we're asking is, please, would you do these things? We have no teeth, there's nothing there. This right here, if we take the date out of this, if I understand correctly, the implementation date, we can actually meet as a council and vote when we use this ordinance. Is that correct?
let me understand, you want to take the implementation date out so that you just have this ordinance and see, and kind of like as I explained earlier, then by resolution, you could set a date, kind of. So you could pass, in my opinion, you could pass the ordinance without implementation date and then pass a resolution implementing the ordinance, saying it goes in effect next Monday or whatever.
Okay.
To clarify, I'm sorry.
How do we do that? How do we say we have a meeting tonight or tomorrow night saying we want to implement the ordinance and we want it to go into place tomorrow, but it has to be published, so it can't go into effect immediately,
Now,
can
we
it?
would pass this by the second reading, and then when we go to implement it, that's when we have a meeting, and then the ordinance would already be in place.
Yeah, but wouldn't you have to put it in the paper with what date you're gonna start? I mean, so it'd take that much longer, wouldn't it?
You have to have a second reading, then it gets published, and then it's active.
As far as the ordinance goes, like I said, these are kind of off the book questions. I would pass it with the current date as the effective date, and then the language in the ordinance that we added earlier today allows for its amendment to be done by resolution. So say we have the effective date of April 9th, and April 1st, you know, everything's turned around, the world looks great, we can have a special meeting and push that start date further back. But I would have the start date set in the ordinance as is.
Okay.
I was just going to say, to clarify, Custer's ordinance doesn't allow for 10 people in restaurants, bars. It's written exactly the same as what Bob read. I got a copy of it here, that they are only able to operate to provide takeout, delivery, curbside, and drive-through.
They're considering an alternate, completely different ordinance that's, I haven't read it yet, but it basically says all businesses are going to be limited to 10 people. It's a general, broad, because they were talking about, as the lady was talking about earlier, maybe allowing for restaurants to operate, but they would include like staff also. So if you have like 4 people working, you know, you could allow 6 customers in.
Okay.
We've got a comment here from the audience. Go ahead.
Hi, Kim Allen here. I wanted to say as a citizen, first off, when I came here tonight, I want to applaud you for having a resolution and giving not only the business owners but also the citizens the opportunity to self-regulate and to do such. I know that many people are already self-isolating and quarantining themselves, as well as just the time of year. And so I know there's been a drop in business as well. But the city is still operating, people are still able to get out, get what they need, and take care of business and get home. I would like to, I'm disappointed to hear the option of the ordinance on the table for tonight, because that does not allow anyone to self-regulate. I know it's been stated, it's just a tool, in case, well, maybe, yeah, it's there. I think that oftentimes we jump the gun And I understand y'all's position that you're in, but also as a citizen, that not only ties the hand of the business owner, but mine as well. And that's what happens. It gets out, oh, well, they're going to do an ordinance on April 9th, they're going to shut down. I have worked for, I have also frequented the businesses here in town as well as the restaurants, bars. I know the people as y'all do, I know the owners. I know they are capable and willing to regulate. You've heard that here tonight. To not only help regulate outside people coming in, but to also regulate their business and their employees. And I just voiced my opinion that I think we need to give the community a chance. These are not uncaring, uncapable persons, not only running the businesses, but also their employees and the citizens as well. So I would like to see the opportunity to self-regulate. I know there's a large fear factor. I have been in the midst of it for a couple of weeks, I'm sure, like everybody has, and doing research, and there's new stuff coming out every day. I caution against pulling the trigger due to fear and jumping the band and jumping the gun. So I was very happy to hear that there was a resolution. I was very happy with the wording of the resolution as a citizen, and to say, hey, let's give it a chance. We are intelligent people here. Let's give the business, all the business owners, a chance to regulate themselves as well as the public, instead of just saying, this is how it's going to be, and then, oh, well, maybe in a week, maybe in 2 weeks, things are changing by the minute. I understand that. So thank you for letting me comment. Thank you.
Kim?
Thank you.
Kim?
Any other comments?
Me? So help me understand, when you think we should pull the trigger? Should we pull it when we have a confirmed case? And I appreciate what you're saying, and I truly believe that the community is trying to comply as best they can. We were in a grocery store today that had blue tape all over the store that showed 6 feet, 6 feet, 6 feet. So it's not that folks aren't trying to self-regulate, but if we just wait until it's upon us, is that the responsible thing to do, the right thing to do?
Well, I think, personally, I believe it's been upon us for months now. We just know about it because we started testing here this month. I believe, and I believe there's other opinions, both personally within the community as well with health advisors in this community, that it's been here for months. That we've had people all year with these cough and flu-like symptoms, and they've been tested for A, they've been tested for B, they've been tested for everything. We don't know what it is, they go home, they get better. So when to pull the trigger? Yeah, I think we do need to wait till it's here. I think it's been here. I think it's on the decline. That is my personal opinion from the research that I have done, and from other health providers and that I have personally spoke to. So yeah, I think it's on the decline. Will we see more? Well, as we test more, yes. Will we start actually looking at numbers? Yes, and that is a question that I didn't bring up tonight, but that concerns me. Where is our benchmark? What are we, everybody says we're flattening the curve. That is the catchphrase of the time, but there's nothing that says when that curve is going to be flattened. What are we?
I think the benchmark is community spread, and that's being tracked by the Department of Health.
Sure.
And that's the benchmark that we need.
And so when you look at that, when you start looking at that, I mean, you brought up when do we pull the trigger when it's here, so I didn't get into that to begin with, but when you start looking at that, you do have to take a step back. It came out today, it was reported today that the initial epidemiologist that said, that blew the whistle about how many deaths, et cetera, with the curve, he came out today and said, I think I might have been wrong. So it's changing by the day, and we have to keep up with that. But to just say, oh, well, let's pull the trigger, it's not here yet. I think it's wise for the businesses and the community to say, hey, you know, let's give everybody a chance to do the self-regulating and to make it known as the council, hey, we are recommending that the businesses are doing this. The businesses are going to be putting up signs. They're going to be telling their customers, hey, y'all, there's a way to separate here. Sit there, thank you very much. Because it not only hurts them, it hurts us as citizens and as a community. And I realize the fear of the sickness and getting coronavirus and people dying, that's a very sad thing for people to die. And it's going to sound pretty cursed. I think that people die every day. Not that I want to die or I want anybody here to die. But I think that with that comes the responsibility economically that has not been considered on a whole through this whole pandemic, epidemic, economically what this is doing to the families. I've worked here. I've had to work 3 and 4 and 5 jobs to make a living before in this town and in this community. And I can tell you that if it had happened at the time that I was doing that, I can't imagine what would have happened. I'm in a different position now. But I don't think the whole economics has truly been looked at, it's all been, oh my God, sick, not economics. And that's more than probably what needs to be discussed here, what can get into without numbers and everybody looking at graphs and numbers and experts and results and all that stuff. But that's my comment, that I appreciate the resolution. I think the ordinance is something that can wait. Obviously, this was pulled together rather quickly here tonight and announced, and we have people here, and y'all are here. So if it does look like there is a significant problem, then it can be pulled together rather quickly. So that's where I stand.
Thank you. Greg?
Can I try to raise this thing up so I don't have to bend down? I'll try. Maybe Carl. Carl, is this thing go up at all?
Yep, adjust it as you like.
All right. That way I don't have to bend over and hurt my back. So you all probably know me as Greg Gunwald. I probably got more time in council meetings than all of you combined. My mom was on the city finance officer for 40 years, and even going through high school at 18 and being on a Monday council meeting every other Monday, I sat in a lot of them. The resolution passes. You need it. It's a recommendation from the city council. You also need the ordinance. The ordinance is powerful. You're right. You know what? It's powerful. But we have the Evans, we have the Brookside, we have the VA, we have the State Veterans Home. One person gets sick, 96 people in New York, 24 of them are dead. They've already taken out 96 of them. You know what? She says it's on the decline. New York today, 2,800 new cases, 100 died last night. I don't know if any of you know this, I'm an ICU nurse that has worked in Seattle Harbor, who's worked out in Pennsylvania in ICU units. I've vented patients. You know how difficult it is when I hear them say that there's 2 patients on 1 ventilator? Imagine that being in Hot Springs. So, you pass the resolution that recommends everybody in the town. It sucks. Everybody says, well, Greg, the bar burned down. You don't have to worry about it, right? No, but I've got a business I want to open next Wednesday. I went and looked at a building today to put a new business in. Sat down with the demolition crew so I could get busy on taking down the vault next week and getting it rebuilt. I'm a business person. I love business. I'm also a school nurse. One of our kids gets sick in this town. Did any of you know that there's 2 new kids? 2 new kids. One's less than 10. One of our kids gets sick in this town because we allow people to do that. That's crazy. You need the ordinance. You need the ordinance with teeth. So you approve it tonight. It doesn't go into effect for 2 weeks. So then next reading, you all look at it and you say, well, we didn't get the incline that we did. So you know what? We could probably allow restaurants, coffee houses, bars to let in 12 or to let in 10, 6 feet apart. Okay? So we're still at no cases in Fall River. Probably that'd be a good idea. We're sitting at 50 cases close around us. The reason why the CDC, not Custer, not the state of South Dakota, the WHO, World Health Organization, CDC, Center of Disease Control, recommends that you shut down bars, restaurants, places where people gather, pools, is so that you can flatten it out. You want it to flatten out. And you're right, people are going to lose income. People are not going to have jobs. The stimulus package is probably not going to help a lot of people. But it gets involved in this town and we're going to hurt. Because we are a town that loves one another. You know how hard it is to walk into a place and not shake somebody's hand? Because that's what we are here in Hot Springs. So, first readings tonight, you approve it. I would recommend that you approve that, just the way that that's written, Bob. In a week, you come back, you look at the numbers then. You can modify it, am I correct? You can modify it to go 10. You can modify it to go 5. You can modify it to go 2. You can modify it to just not even changing it. And then, based on where we are sitting at, and then, am I right, Misty? Then it's got to go published.
Modifications would require a second first reading.
Yeah.
So it would delay it, but you are correct. It can be modified between the first and the second reading. If it's substantial, then it'd be a new first reading. We have another second reading 5 days apart.
And then it would go to the paper and it'd be published. But at least by then, we would have a better inclination. People came in from New York to a bank in Rapid City. Who knows who got affected? This is the concern that we have. Here's the other question. How many police officers do we have on duty at any one time? So you're going to put 10 in a pool, 10 at Dale's, 10 at the meat locker plant, 10 at Bourbon County, 10 working on the deconstruction of the vault. I mean, all the way through town, you're going to put 10. What happens when there's 12 and you got an officer down there because some little granny says, you know what, I saw there was 12 people in here and she's called the cops, but yet you got a car accident there in the town. I mean, that's what they want, to deaden it out. You want to flatten that. You don't want the curve. It needs teeth. And you know what? You're right. As a business owner, it sucks. It sucks worse than anything that this is going on. But I tell you what, I'd rather shut down and lose a few $1,000s than to have one person in this town die. And one person in this town die. I don't care. Somebody said people are going to die if they're going to die. What happens if she's 12? What happens if she's 30? What happens if she's pregnant? What happens if she's a mother, or he's a father, or he's a grandfather, and he dies because we didn't take teeth? Thank you.
Thank you, Greg. Are there any other comments?
Thank you, Greg.
I have one question for understanding, I guess, and I'll address it to Bob, but I think would address Greg and Kim's comments. Bob, in paragraph 11, and I lost it, and I apologize for that. It says, the last sentence of paragraph 11 says, additionally, while this ordinance is in effect, it may be amended, suspended, reinstated, or repealed by resolution of the Hot Springs City Council. Am I correct in my understanding, if we approve the first reading tonight, and then we approve a second reading, then come the 8th of April, if we determine that current conditions are such that we really don't need this to go into effect, we could pass a resolution that says we're going to delay implementation for a period of time. Or we're going to amend the paragraph that limits or forbids on-site, on-sale. Can we do that? Can we amend it a week at a time, a day at a time, a paragraph at a time by resolution once the ordinance is passed?
I think that's a question for Garland.
Grab the
A
mic,
good
Garland.
question.
Garland. Darla, can you just grab the mic so then everybody can hear it? Can you hand that to him?
Do a little karaoke for us.
I do a bad Elvis. Thank you. So kind of going back to the explanation, ordinance, resolution. Ordinance is the law, resolution is the administration of that law. That's kind of a basic rundown of it. So by having this provision, this is a kind of a particular, it's not a normal addition to an ordinance as far as having to be able to amend by resolution. But I've been in several conferences with other municipality attorneys concerning this issue. So it's our opinion that the resolutions can amend. I would say if it's something as significant as really changing verbiage, like saying instead of closing, we're going to allow 10 people in. I think that would be a whole new ordinance. Okay, if you wanted to really amend it, as far as changing the date, or if we get to the point, like I said earlier, if April 8th comes and everything's looking good, we could have a special meeting and say, hey, let's push the implementation of this to April 30th. And we'll go from there.
And that's probably a more realistic question, is the effective date of the ordinances, because we've got a couple of weeks before it would go into effect, and as we've said many, many times tonight, things change daily, and that's why we need to do something now, because we have to wait so long for things to take effect. But by resolution, if things still look good, by April 9th, by resolution, we might be able to say, okay, effective date is April 10th. I'm being a little facetious, but we could do that.
That's correct.
Okay.
And so, and I'll make this statement. One of the reasons why I guess I would support the ordinance is because of the timing of our laws required for ordinances. And since we don't have, we have a once a week newspaper, so we kind of are behind the gun on that as far as publication of the ordinance. Because the publication, that triggers the actually going into effect. So, the 5-day period between the first and second reading, it's all a matter of timing. If we wait, if we fall, like if this meeting was next Monday, we'd be out another whole week or so before it could be actually in place, just because of publication.
Are there any emergency procedures for a stated disaster emergency that could preclude those time limits?
As far as my researching, none. I even looked at the governor's declaration. Didn't see anything that would supersede, our ordinance requirement. This is kind of, this is of course an unusual situation where communities are not really placed in these circumstances that often.
Yeah, I understand.
I actually would hope to see something from our state government. That's why we added the language about this. This won't supersede any state declarations.
Got a comment from...
Hello, I'm Roxanne Bridgefield, owner of the Dairy Queen. Most of you know me. And I just wanted to let you know what's happening with our business. Right now, people are playing it smart. It's probably been close to a week, and we have not had more than 10 people in our dining room area at once. They're sitting way apart. When they come in and order, they stand away from each other. Right now, 75% of our business, I would say, is through drive-through. Probably another 10% is carry-out. But there are some that still like to come and socialize with a friend or their family, and they won't come in and sit far apart. So people are being smart about this. And I would pray to God that, say, an employee would come down with the coronavirus, that any business in town, if they had that problem, they would shut their business down. We have not been told from Dairy Queen headquarters to shut down our dining room yet. That's in Minneapolis. We have not mandated that yet. I would say the best way to do, I agree wholeheartedly with the resolution. The ordinance, not so much, because it is going to hurt. It won't hurt us a whole lot, but it will hurt other businesses and it'll hurt us a little bit. So I do not agree with it at all. I think the best solution is to stay informed. If cases start popping up, I would hope, pray to God, that 60 and older would stay home, the businesses would close if, they'd been exposed. I think adults are smart enough in this time with, they're seeing outside of us. And like I said, keep informed. I've heard rumors of 1 or 2 cases in Fall River already. Right now, I think it's just rumors. I don't know.
Those are just rumors.
They are just rumors.
I check daily with the Department of Health, and they do give excellent statistics, and those are briefed every day and updated on their website every day. And so we do check with that every day. And there are, as of now, there are no official cases. There are some tests pending, and we are aware of that. And so we follow that on a daily basis.
And I'm also saying that unless you lock down the town, you are going to get travelers through town. We get people from going to Denver, to Rapid, to Sioux Falls, whatever. You're always going to have that. You're always going to have the chance of exposure. There's no way we can not. And probably Dairy Queen's one of the more exposed from people traveling than anybody. And right now, we're fortunate. Our employees have the choice. We have been washing hands like crazy. We're sanitizing the inside 100% like crazy. Every time somebody leaves, we're wiping down door handles, light switches, everything. So we're doing everything we can right now to keep the situation under control. And like I said, information is the key. The ordinance, I don't believe it. I don't believe in it. I don't think you're going to hurt the businesses that are open yet. But the resolution, 100%. And that's been the guidelines all over. So thank you.
Thank you. Are there any other communications from the public? We appreciate your diligence.
I'm Troy Gibbs from the Dewdrop Inn Cafe. We'll open April 15th. Our dining area will not be open. But I will tell you that I don't need legislation to tell me to do what's right. The last thing I would want is for the Dewdrop to go undisputed. I'd be a lot less concerned about a fine than I would be to let myself down or let the community down. I'll be in that one that help distribute down. I guess in a nutshell, that's what I think. Thank you.
Thank you.
What did you say your open date was?
15 April.
Are there any other comments from the audience? Any other comments from the council?
I have a question for Garland, and it goes along the line of what Bill has been asking. My understanding of a first reading and a second reading, as long as there aren't significant changes, if there are changes recommended from the first reading, and those changes aren't significant from the second reading, then there doesn't need to be another first reading.
That's correct, as long as there's no significant changes.
So to the significant change, it's been requested, suggested that the no more than 10 people be broadened to include everyone, so that businesses like Dairy Queen and the others could have up to 10 people in the building. Would that, if that language was added, would that be a significant enough change to require a new first reading?
My opinion, it would, because it would change the essence of the ordinance.
Okay.
What if we change it tonight during the first reading?
It could be amended tonight as far as allowing that language before we haven't done the first reading yet. We could have you'd have to do a motion to modify. I'll pick this out. Do a motion to modify. And I got a little behind. We haven't even did the motion for the ordinance yet, right?
Correct.
No, what we've got on the floor is a resolution, and I guess if we've heard from the audience and the council concerning the resolution, I would like to go ahead and ask the council to vote on whether we accept the resolution or not as it's written. And then we would consider the ordinance separately. I think we've had the opinion that both the resolution and the ordinance could coexist. And so I would ask if there are any further comments on the resolution itself. If not, I would ask that Misty, you would call the roll, please. And this is now, we're voting on the motion to approve Resolution 2020-11.
David Burris,
Yes.
Bill Lukens,
Yes.
Bob Nelson,
Yes.
Ron Richards,
Yes.
Allison Ritterbusch.
Yes.
Craig Romy,
Yes.
Caitlin Turner.
Yes.
Thank you.
Okay, the resolution is approved. Now we have an additional item, and I would accept a motion to approve the proposed ordinance 1212 that Bob read tonight, in its entirety, I might add.
I'll make a motion to approve ordinance number 1212, an emergency ordinance to address a public health crisis by implementing certain measures which have been deemed necessary to slow the community spread of coronavirus COVID-19.
Second.
Okay, it's been moved and seconded that we approve the ordinance as it was read. Are there any comments and discussion from the council?
I just have one comment. Everybody's concerned about the elderly. Last night on the news, it said a 17-year-old died. So it isn't just the elderly that's jeopardy. That's all I have.
Okay, thank you. Any other comments?
Well, for me, if we're considering adding no more than 10 everywhere, trying to figure out where to put it and how to say it.
If I may interject, I believe that I don't think we have the time to even think, because it kind of almost, half the ordinance would contradict itself if you just put that in there, you know. I don't think we have the time to sit here. We probably could, but I think if you just interjected some kind of paragraph that said, but we allow 10 people to be in your business, it throws the whole ordinance, the writing off. I don't think we could put in something like that. It's just my opinion. Because, I mean, you've got...
Number 5, is that what you're reading, Garland?
Well, I mean, you've got 1 is closed, 2 is closed, 3 is closed, and then we're going to add a provision somehow that says, okay, instead of being closed, we're going to allow you to be open as long as you don't keep 10 people in.
Yeah,
I just think it just...
But that's what 5 basically says, as far as how I'm reading it. 5 is basically saying you'll be closed if you have 10 or more. But that reads 10 or less is okay to me. But that's what I'm asking you, Garland, is that?
Correct. Well, 5 was meant to be a catch-all provision as far as we have our specific businesses and groups and different activities that are specifically banned. 5 was meant to be as like Well, think of like, I think I put in the notes, like a large hair salon in Rapid that constantly has more than 10 people. Under 5, that would be shut down. So it was meant more as a catch-all than to really comment on, you know, the 10 people issue.
And I have also a question for the council too. We've mentioned what would cause this ordinance to go into effect if situations remain the same or got better within the community for a while and we wanted to delay it. What would you consider a trigger point that would say that this ordinance is implemented as written?
Without any changes between now and the second reading, that date would be April 9th.
So there's no provision if the situation remains the same, that we have no community spread, no cases in Fall River County, then we're going to implement this and close down all the businesses is what or all the businesses located in paragraph 1, 2, 3, and 4.
Well, I thought that's what the safety net that we were discussing is, that we would be having either resolution or having our second reading where we would not even have to pass it in the second reading because we see that there is no community spread. I think what we're getting to is that you're running into parliamentary procedure that makes us have to go ahead of time to address something that we have no idea what's happening 2 or 3 weeks down the line. And so I see this as, hopefully we can, the second reading, we have more information and we can say absolutely this does not pass through the second reading. But then even as I understand it, Arlene, even if we pass the second reading and April 9th comes along and we have no community spread, we can by resolution say absolutely we're not putting this ordinance into play. Or that we're putting it 2 weeks down the line to address it at that point.
Correct. We will have the date set right now is April 9th, 6 p.m. Council could meet at a special meeting April 9th, 5 p.m. And by resolution say, due to the lack of spread of the virus, we're extending the date to June or 2 weeks or whatever the council's choice is. Like I said, the ordinance could be modified, not significantly, as far as like, as I was saying earlier, not by resolution, not a huge change. But things like that, the implementation date, that could be done by resolution.
Wouldn't the ordinance have to be effective first before we can change it by resolution?
Good question.
So maybe if we met at 7 o'clock or 6
Well,
o'clock.
the ordinance goes into effect upon publication. So it goes into effect that morning, but we have the 6 p.m. time limit. So it's going to go into effect as soon as the first newspaper comes out.
Well, our ordinance says effective at 6 p.m. on April 9th.
Well, once again, by statute and ordinance by statute, state statute, goes in effect once it's published. So I would consider the timing of it, that it goes in effect, was when that first newspaper comes out. But the actual closing goes into effect at 6 p.m.
Okay, if there are any other comments from questions?
Community spread would be the trigger that, I think you were asking what the council thinks the change would have to be to make us meet. Were you saying?
To look,
community
just
spread?
to look to call either an emergency meeting or, consider a resolution to either change the date earlier or later, whatever. And I maybe would suggest that we would use the state's classification of community spread. They do investigate the cases to determine where the infection, if we do have an infection in Fall River County, where that came from. If it came from a source outside of the county, then that would not be considered community spread. But if there are cases that they ascertain came from a source within the community, then they do update that and identify that as a community spread. And that's one of the things that obviously we really want to try to stop. It's very difficult to stop someone from coming into the community or traveling, and ensure that they self-quarantine other than by recommendation. So that would maybe be something that as this ordinance is passed with the dates effective, it's my understanding that our legal counsel has said that by resolution we can change that date. Is that acceptable and understood by all the council members?
Mr. Mayor, I want to make, kind of stepping back one step to that effective date. I think as far as changes to be made to ordinances is usually like either to clarify things or change verbiage, not significant changes, as we said earlier. I think 1 through 5, the effective should be deleted. And it just should say at 6 p.m. That way it clarifies, there's no confusion on, because we have a state statute that says when the ordinance goes into effect, and then there's this language here. I would propose that effective on 1 through 5 be eliminated, so to avoid that confusion.
Is that acceptable? And I can't remember who made the motion. Bob. Would that be acceptable to you?
Yes, because our attorney is recommending it. And I've been guilty of this in the past, not following legal recommendations, but if that's your recommendation, Garland, I'm fine with it. To Dave's point, this is a tool, and my concern is that if we start trying to figure out what would trigger a change, would this trigger, would that change, or would this trigger, when we start talking about community spread, as I understand what I've heard the governor's office say, community spread is identified by the number of people that have it in a given community. Where it came from.
No, it's governed by, Bob, excuse me, I just want to correct something here. Talking with DOH, it's governed by the source of the virus. There are several communities that had several different people identified, but they all came out. The source of where they contracted the virus was from out of the community. And one of the things that will be a problem in the future, if this does continue on, the resources may not be able to garner or gather that information if the number of cases increases. So that's kind of what they use as a definition of community spread.
So let me remove the community spread from the statement then. My understanding of listening to Governor Noem, when she identified Beadle County as having community spread, it was because a number of people in Beadle County had the virus. Now, where that came from originally, where it originated from, for me, isn't important. What's important is that there were enough people within Beadle County to be identified as community spread. So if we were to focus on that, what that essentially says, if we're going to key on that, we're acknowledging that there are enough people within Fall River County that we need to address this. And I don't want to be behind the curve on this. I want the tools in place. I feel it's important to have the tools in place to address it if and when it happens. And I think that's what an ordinance does in addition to the resolution. Hopefully the resolution gets the statement out to the public that we're taking this seriously. And if we need to, we have a resolution to get more aggressive with.
Okay, so what we're dealing with then is an amended ordinance with the effective time and date taken out of it, and I can't remember who made the second.
Caitlin.
Pardon?
Caitlin.
Caitlin, are you agreeable to taking that language out?
Yes.
Second. Okay.
I have a question, Mr. Mayor, for the attorney. We're taking 1 through 5 out.
Just the word effective.
Oh, okay.
We're gonna leave it
Okay.
at 6 p.m.
Okay.
Each one will start with at instead of effective. That way it avoids confusion when the actual ordinance comes into effect.
Okay, and are there any further comments or questions concerning the motion that's on the floor to pass the ordinance as amended?
I just want to say, anybody that knows me well probably knows I'm not real fond of any form of government telling me what to do in my personal life. But I think it will be bad people if we don't vote for this.
What, I'm sorry, I didn't catch the end of that.
How's that?
I didn't catch the end of what you said.
I said, I think if we don't go through with this ordinance, we're essentially the bad guys.
Okay, any other comments? Hearing none, I'd ask Misty that you'd call the roll.
David Burris,
Yes.
Bill Lukens,
Yes.
Bob Nelson,
Yes.
Ron Richards,
Yes.
Allison Ritterbusch,
Yes.
Craig Romy,
Yes.
Caitlin Turner.
Yes.
Thank you.
Okay, the ordinance has passed. And again, I just want to thank you as a council. We're going through some very serious times and some very untreaded waters. I thank you, Garland, for your advice. And I think we've made some very responsible decisions tonight. I want to thank the community who've implemented already much of what we've stated in the resolution, and we will press forward and hope and pray that we will be passed over by this. And again, thanks for your cooperation. With that being the last item on the agenda, I'd ask for a motion to adjourn.
Make a motion to adjourn.
Second.
Been moved and seconded to adjourn. All those in favor signify by saying aye.
Aye.
Opposed? Motion carries. Thank you.
Hey, Greg.